Human stories from around the globe. Impact Your World Fact File in association with NEC. Empowered by innovation. NEC.
Featured this week, the Afro-European Medical and Research Network. Founded in 2006, Aemrn coordinates with more than 40 other organisations to improve public health in Africa. For more ways you can help improve public health in Africa, log on to our website, cnn.com/impact.
The common mosquito is more than a simple nuisance. Throughout the world, it carries life-threatening diseases to the most vulnerable. In Africa, one group is using a surprisingly simple device to combat the dreaded insect. In this week's Impact Your World, Aisha Cisse shows us how a man-made flower is fighting malaria.
Swampy area right
Thomas Kollars has come to Kenya, to this slum outside of Nairobi, to find the perfect breeding ground for mosquitoes. In 2006, nearly 1 million people died from malaria, most of them in Africa. The World Health Organization estimates that a child dies from the disease every 30 seconds.
This is a large swampy area right at the base of Kibera, the slums in Kenya, in Nairobi. In that area of Kibera, 78% of the people have suffered malaria. And this is a prime breeding habitat for Anopheles mosquitoes that transmit malaria to these people.
Kollars, an epidemiologist, spent 11 years developing a weapon to fight malaria. It's called the Provector.
Provector is a flower-like device that uses a sweet nectar-like solution to attract mosquitoes to feed on a formulation that kills them, eco-friendly and cheap device for controlling mosquitoes.
The flower-shaped device costs $7 to $10, and Kollars says it contains a safe biopesticide.
Substance.
So he's come to Kibera armed with Provectors.
In Kenya, the average salary is about $360 a year for a family of 4, and they spend about $110 a year protecting their family from malaria. So you could imagine if in the United States we spent 1/3 of our income on controlling one disease that affects our family.
Emmanuel Clotti, a Ghanaian doctoral student who works with Kollars, almost died from malaria when he was 10 years old.
To really control malaria, then you need something in addition to the net that even when people are not under the net, that thing still protects them.
Kollars partnered with the Afro-European Medical Research Network. The physicians and public health officials have distributed 1,000 Provectors across Africa. According to the survey done by Aemrn, 90% of the people using the Provector reported that it was effective in reducing the mosquitoes in their house within a month. Those results were presented at a symposium on malaria control in Amsterdam in September.
To see the conditions that people live in. And they have their homes, and, you know, describing it isn't like being there and having a child hold your hand that 20% of those kids you're holding hands with are going to be dead in a couple of years.
For Impact Your World, I'm Aisha Cisse in Atlanta.
For ways you can help fight malaria with the Provector flower, visit our Impact Your World website. You'll find it at cnn.com/impact.